Good morning, everyone. Assalamu alaikum, sabah al khair. Great, we have everyone now in the room. It's a great pleasure to be back after the summer breaks and after a long time of not meeting everyone in the network. So I'm very happy to see lots of familiar faces. And this is going to be a very busy season, so we're starting now, and then we have a few more events. So stay tuned for the events that are coming up, especially in October for sure. We have almost the plans ready, so we will let you know about them. And hopefully one during COP as well. So very excited about that. Today is a topic that I think we have spoken about, but maybe not in great details. Today is really about how do we use digital health as a transformational tool in healthcare. We have been seeing lots of new ideas, lots of new companies, startups, disruptive technologies, but the question is, are we transforming that into our day-to-day healthcare activities, whether it is diagnostics, whether it's prevention, seeing patients, patient information. And so today we're here to talk about the journey of the transformation, where we are, what are the challenges that companies are having today, what can the regulatory environment do, and also what are new things that we should be adapting that perhaps are not adopted yet. So with that, I call upon Ahmed Al-Benna from Ernst & Young to... Thank you, Ahmed.
All right, so good to see familiar faces, and happy to be sharing this podium finally after many years. The Advanced Health has been a dear event to my heart from day one. So thanks for Marwan and everyone who created this platform. Like-minded people, familiar faces, and people who come together to make the world a better place. Let's start. So if you've been reading The Time recently, you probably have seen that. Correct? So I was looking at it yesterday, and I thought it reminded me of something, and I found it. It's Arnold Schwarzenegger in The Terminator, right? Yeah. But that wasn't it. It was actually the other Terminator who was sent to kill Sean Connery, right? So this guy here, Brian has spent more than $4 million to develop a life extension system called the Blueprint. And it's a data-driven system to reduce the biological age of his body. He gulps 111 pills every day and goes through hyperbaric and cryotherapy chambers and sleep therapy to rejuvenate while sleeping. He radiates his head to some sort of red light to keep his scalp healthy. And as a result, he's now at 46, his muscles and bones are at the age of 30, and his heart is at the age of 37. Impressive, right? Would you like to be that? Yes. Okay. Would everybody agree to that? The question, this really made me think. And as consultants, we keep thinking and asking questions that probably never get answered. But what is healthcare really about? If we succeed in achieving this, all of us, is that what healthcare is supposed to achieve? And that asks me another question. What's my role within that change? According to the World Health Organization, a healthcare system is about improving the health of people, creating health equity in ways that are responsive, financially responsible and fair, and utilizes available resources. Available resources. If we think of everything around us and how things are evolving slowly, we're slowly making more resources available for such a change to happen. But again, we'll take one step backwards and look at where we are today. Let's analyze and look at how the healthcare system looks today. There is an aging population. 3 times the number of people will be aged 80 or more in the next few years. In fact, just yesterday, I read that Japan has achieved 10% of their population above 80 for the first time ever in their history. So the population is aging. And in the UAE, we're talking about almost 16% of people becoming above the age of 60 by 2050. If you don't know, that contrasts to 1% today. So in a few years, it's going to be 16%. There's a demographic shift happening around us. The second thing is, there is a growing chronic disease burden. And this amounts to almost 2.2 million people in the UAE by 2040. To give more details, we're talking about 68% of overweight people and 28% of obese people. The impact of chronic diseases, direct and indirect, in the GCC amounts to almost $100 billion. And that's in 2019, before COVID. There is another shift, clinicians' workforce shortage. Today, there's 18 million jobs that are vacant, and there's shortage in clinicians. And not just clinicians, on the entire health workforce globally. And in a few years, more than 40% of physicians will be 40 years and above. Sorry, will be 60 years and above. So they're getting older. And then finally, the costs of care are increasing globally. In the Middle East, we're talking about 11.7% increase versus the lowest in Europe, which is 6.7, and the highest in Latin America of 14.2. And in the UAE, we're talking about almost $17 billion of spend on healthcare, which amounts to 5% GDP, which is among a good number in the region and probably around the world, except for the US. So this is the snapshot of the healthcare today, with all the spending we're seeing, with all the players, with all the technology and research and all the players. It's probably not working in the way we would like it to work. So our current healthcare system keeps trying to catch up with healthcare burden, and not the other way around. Makes me ask another question and take a step backwards. What constitutes a healthcare system? And if there is one thing that I would like everybody to leave with today, it's going to be, what is my role within this change as a healthcare practitioner or a player within the healthcare ecosystem? There are triggers that are changing healthcare around us today that lead to these numbers. The first is the technology forces changes. There is 41 billion connected IoT devices globally, and that will be by 2027, in 3 years from today. The second shift is the socioeconomic forces, and there is more than $30 trillion of spend on chronic and non-chronic diseases, and the UAE has, on its own, $26 billion spent by 2028. You can look at it as an opportunity, and you can look at it as a burden. Depends which glasses you're wearing today. Yeah? The third is the customer centricity, and by customer here, of course, we mean the patient. More than 50% of patients are willing to explore virtual care and new smart ways of treatment, and that wasn't the case before. And then the required capital efficiency, and you need to know that the GCC healthcare systems are operating with at least 25% wastage. Look at the picture here in this image, or this graph. This is what makes up a healthcare system. There are payers, providers, regulators, administrators, medtech players, pharma, R&D, universities, education, community, and others like investors, consultants, and so on. Where do you sit in that ecosystem? It's important to know that and to know where you'd like to be a few years down the line and what would be my role within that shift and towards that issue. Let me ask a quick question and maybe shout out if you'd like to contribute. Who out of those 9 stakeholders do you think is shaping up healthcare? Who decides what's the next step? Regulators? Any other? Payers? Pharma? Sorry? Which one? Tech companies? Well, pretty much. It's a mix, right? But for sure, regulators play a role, but are they reactive or proactive? So pharma, medtech, investors spend money. And regulators usually, I know regulators are not going to like that in the room, but they run behind technology to create regulations that would work and won't, in other words, create a disaster. It's important to know where you sit and where you play in that area, because otherwise we can't work as a team to improve healthcare. Now, the value is created by understanding three things. First is that data is old. Data that clinicians get and data that is produced out of a healthcare system is old. By the time it's collected, processed, anonymized, sent back to you, it's probably a few months old. The second thing, data is narrow. It doesn't show you the full picture. If Ahmed has an issue and I go to a physician, he will ask me for questions. He doesn't really have my data. He doesn't have my socioeconomic data. He doesn't have my sleep patterns and so on. And the third is that data provide points and information. Translating that to results and insights are where the real value is. And that's what everybody is working to achieve. This is the missed value that has been captured by lots of players, big players. What you see in the picture here are the world's top players in healthcare today. I don't see any pharma there. I don't see any hospitals or ACOs. Pure tech. Players that are emphasizing on cloud computing, wearables, IoTs, they're like treatments, prescriptions, refills, and all of them are looking at the future value of disrupting payment systems, health finance systems, remote patient monitoring, your data, and they can't wait to become the next EHR. They can't wait to become the next payer. So just take a minute and think. These are shaping up healthcare. Today's topic is moving from digital to smart, and there are three essential things to keep in mind. But before that, let's have a look at what makes a healthcare system smart. When data comes to the system, it needs to be received and welcomed by a future-ready healthcare system, a system that is technologically advanced, connected at high speeds, creates this interconnectedness between people, environment, and infrastructure that speak to each other, unified, intelligent, and optimized. The second thing is this system needs to be a smart system, a system that connects to other platforms with value defined, not randomized, and then with regulations that enable connections, enable insights, and enable working out something useful out of this data. And then finally, a system that embraces emerging technologies and doesn't just talk about it, like generative AI, like emerging concepts such as metaverse and the N of 1. These are just examples. So what are those three shifts and the three triggers? The first is that till today, healthcare systems are based on supply side. Whatever is present, we push it. And we all know as professionals that even supply chains now are changing that. They are moving to become demand-driven. Demand in that case is the patient. So to move to the demand side of the equation, utilizing what we've been spending the past years doing of digitizing the infrastructure, digitalizing what we can do, should come to fruition by shifting the demand to the patient side and the pull side. So if there is a need, I pull, not I produce and I push. The second shift, optimizing patient and workforce experiences. It's important at the touch points between patients and the health workforce in the healthcare system to have a clear role and a clear expectation. As an infant in the beginning of your life, you're expecting that the healthcare system would be centered around the baby, around the new generations, make them healthy, make them live longer. As you age and get older, you need a simple healthcare system, a responsive healthcare system, and as you age, you want to know that you're in safe hands. As a physician and a healthcare worker, you need to be able to provide personalized care. You need to be able to navigate all those tools that are difficult to use and not just make them overwhelm you. And then finally, you need to own the result and be a part of the ecosystem. The third shift is what hospitals and clinics move through. So at the beginning, traditional hospitals, which is probably very difficult to see these days in the region at least, You see traditional hospitals using paperwork. Still exist, but little. They do. I've seen them. And then they digitize. Digitizing is purely moving from paper to digital. So like you have this big blue book, and it just becomes digital. And then you digitalize it. You start connecting specific tools that automate specific workflows within your ecosystem, within your hospital. You become slightly connected. And then as hospitals and systems start speaking to each other, involving everybody in the ecosystem, you start creating the value that we're expecting out of a smart healthcare system. This gives us a very brief look at what makes a healthcare system smart versus digital. Now let's have a look at the UAE in particular. Recently, the UAE 2031 was launched. And regarding healthcare, it says that we need to generate, or we will generate, an advanced, integrated, accessible healthcare system that focuses on enhancing the quality of life of individuals, support healthy lifestyles, and enjoys the highest level of future readiness and the quality in specialized care. We've all spent many years here, and we know that when this is said, this happens, right? What is our role? Back to the first question. What is our role within that journey? In the Future Readiness Index in 2022, the UAE has scored really well. So we operate in that ecosystem, and we should get the benefit out of it. 27 is what UAE ranked out of 124 countries. The top score areas were the digital usage, transport network, the physical capital, and the digital infrastructure. And in the middle was human capital, technology, and competitiveness. So we're pretty much poised to do a good job when it comes to moving to smart. If we look around us, most probably all of us have interacted with one of those 5 initiatives. Riayati, the unification of the 3 famous the health record systems. Hayat, organ donation program. Tatmeem platform, which is the first national track and trace solution. The 3D digital metaverse assessment service by MOHAP, and the life sciences system for the healthcare in the metaverse by Abu Dhabi DOH. These are examples of real-life smart tools and smart solutions that currently are happening around us. Let's take a deeper dive and what that means in reality. If you look at generative AI, in case you don't know, generative AI is, an example of it is ChatGPT. Something that works on its own. You ask a question, you get an answer, and makes you look professional, right? The potential applications in healthcare include integrating diverse medical information like the genome. Imagine throwing a genome at generative AI and start asking questions on how likely is Ahmed to generate CVD by the age of 50? And it starts telling you things. Now, what controls that? An example for future use is drug design, helping accelerate drug design, creating synthetic data that can be used to accelerate clinical trials, and then completing something as simple as paperwork for discharge papers. There's no need for somebody to sit and do it. Let ChatGPT do it, right? Government's attention is now focused on building regulations that make it responsible generative AI, ethical generative AI, with clear consequences and responsibilities. That is concerning because imagine if there's misdiagnosis or the other way around, if you use ChatGPT or anything similar to do your homework for you. Examples of generative AI include companies like Atropos, that is used for on-demand clinical consultation. You can actually ask it questions, and that's happening today. Syntegra, for the generation of synthetic data, and Intos that work and use generative AI for advancing drug discovery. Second example is digital twins. Using intelligence that we have and tools that we have to create digital twins. That could be of places, it could be of systems or functions, it could be of human beings. Create a digital copy of you and start experimenting. Create a digital copy of the hotel and see the flow of people in and out and how can I improve that. Singapore has done a full 3D, high-quality digital twin for the country to start experimenting how to improve things. This is real life, it's not imaginative. Currently is being used in healthcare to optimize healthcare systems, Future uses include trauma management and personalized medicine. How can you respond to specific treatment yourself in the metaverse? And then a real-life example is Mater Hospital in Dublin that has used a digital twin to optimize their radiology department and has created massive results. Last is the metaverse. We know it, we live there, we see it, we hear it. It's not there yet, but it's important to know that's being experimented. It's important to know that Dubai has launched the Meta Incubator, which is the first incubator of metaverse in the world last year. And the purpose was to attract investments and people to come and experiment here, creating and attracting talent. Abu Dhabi has also launched the life sciences system for healthcare and metaverse to again pose itself as one of the key players. Examples today include Chile and HandVR. They're all used for augmented surgery guidance systems. Imagine that you're operating with metaverse and VR and the reality so that you can see what you're operating on virtually as you do that in reality. And then Goggle Minds for medical education and XR Health for home physical and occupational therapy. Again, you can do your own physical therapy at home in the metaverse. The global market size of the metaverse in 2022 was $6.5 billion, and it's expected to reach $72 billion by 2030, and that's not far from today. It's a massive growth area. Now, hypothetically, since we're talking about space, there are more experiments that are happening. One of them is the digital humans, creating a digital copy of you completely with all your metabolism, all your genome, lifestyle, preferences, everything. Put it on the metaverse and start playing with it. How would Ahmed look if he exercises 2 hours a day for a month? I'm sure different. Things like that. And then immersive reality. Living, and you've seen a movie that was there a few times, a few years back, Ready Player One. Life is a junkyard, and people live in the metaverse a beautiful life. Immersive reality is coming. So when this guy talks about recreating his body and using his own data to improve, he's actually maybe 2 steps ahead. But the question remains on how can we in healthcare systems utilize what we have in a smart way to generate value. Professor Rachel from the UK Government AI Council tells us that we're still waiting to see how humans will consume the metaverse and understand the areas where it will still work. So with that, I'll leave you with one question. After what you've heard today, how can an intelligent, smart healthcare ecosystem that is being generated nowadays in the UAE put this country on a global trajectory for success and to attract all the investments? Thank you very much. Appreciate it. I would like to invite the next speaker, Dr. Louisa from Plug and Play.
Thank you. I'll try to be as informative and entertaining as you, but it's not going to be easy. So, we've looked at it from sort of a holistic macroeconomics and like a mega trends perspective. We're going to dive into the numbers and investments because we're going to see where's the money going and why, globally, but also in the UAE. Just a slide about myself, just to tell you, I come from the other side. I'm a pharmacist. I worked in the pharma sector, the most, traditional companies, and seeing the problems from that side has informed and kind of shaped my view of the technology and the promise of technology with all its, limitations, I would say. So, just a brief background of Plug and Play, because you might hear this funny name a lot, but we're essentially, we started out as a venture capital, hosting none other than the Google founders until they became 50, and then they moved to a larger location for their growth. And we really, stumbled into venture capital sort of by chance, because if you lived in the, down University Avenue in California, you just are bound to meet those disruptors, those crazy engineers that had ideas on how to change things for every industry. And that's how it was born, and we started thinking, okay, so capital is not enough. what else can we do to help these startups grow? And bear in mind, a Google, a Logitech, and PayPal were all startups at some point. And we're like, okay, this is market access. How can we then, unlock the potential and the demand side, meaning the industry and those legacy players, to consume these technologies? And this is where the whole sort of thesis around acceleration of tech was born. And we've decided to really focus on that B2B side, as well as connecting the industry, the demand with the supply, to really see where it sticks. And now, we've been fortunate to be here since 2018. And like Ahmed said, it takes a village. So we're mere connectors, but that whole ecosystem is what is needed to really unlock the full potential of technology, whatever the industry is, but more importantly, for such a hyper-connected and complex sector like healthcare. So, what makes us legitimate to talk about investment today is we've been fortunate enough to have 33 unicorns. Those are pure investment we made with the own capital of Plug and Play, so there are no LPs, there are no GPs. It's just one man with a very good address book. I wish I was there for many of those exits, and surprisingly, not so surprisingly actually, 2020 was the most prolific in terms of exits and unicorns with 12. And we expect this trend to continue. Sector agnostic, but we're here to talk about health and really specifically dive deeper into the macro trends of digital health investments. Typically, especially in the region, we were looking at large deals made by sovereign wealth funds. 40, 50 million plus USD poured into a Series C, Series D company. But that is changing. And that the trend, you might have seen that it's a VC winter or investment winter, with investors being more cautious on how they spend. There was a whole madness following the COVID. So after 2020, everyone suddenly looked at technology as a digital health as the new kind of sector to pour money in. But then, of course, recession, macroeconomic conditions, and the difficulty of digital health to scale, because you have regulations, you have complex stakeholders to manage, and we've seen what happened with Babylon, from hypergrowth to crashing and burning. What lessons can we kind of extract from this? So the investors are in general more conservative, but interestingly, there is an uptick for fewer deals and lower check size, meaning we invest earlier. So we're taking more chances in more disruptive technologies, but just early on. So we have to find them at idea stage or at post-MVP stage, and we can fuel their growth. But anything beyond that, and that's the problem startups can face when they are growing, and then to go to the next steps, you typically need additional capital that investors are, hesitant to deploy. So again, and a fewer crossover investors, that's also interesting. So what is a crossover investor? It's an investor that follows you from your early seed stage all the way to your IPO. There's fewer of that. So even the confidence in your own portfolio has decreased, because again, the availability of capital is really the question here. But then, of course, another interesting trend is the growth of mega deals. So all these that are led by growth funds and private equity, like buying huge assets, consolidating assets in home care or remote care, that's exploded in growth. That's 44% of those deals in H1 of this year. And I think you will see that in the Middle East, it's kind of similar. But it also has its few specificities. So, snapshot, no question asked, those are the three biggest markets in the region. Israel with its own ecosystem, mostly coming from early stage ventures. So idea stage. Why? They have a very developed university and academic ecosystem that allows them to, boost the creation of those ventures. Yet they have the same problem that many global locations have, is after a certain level, they all go to US, because that's where the big market is for their growth. The government there is spending a lot of money to make those ventures grow from idea stage to post-MVP. But then the value for the Israeli ecosystem in creating jobs kind of is a question mark, because all these good ventures then chase venture capital and growth in US or other mature markets. UAE is a powerhouse in the GCC when it comes to ventures. We account for 42 different ventures across digital health and all the realm, with 123 million total value of these ventures. We have to take those numbers with caution, because it's a very new and niche sector. I remember just in February 2020 looking at the market and not being very optimistic, because no one wanted to pour a dime. No one believed in telemedicine. Oh, regulations, we cannot get approval. Remote patient, no. People prefer to be at the hospital. So all this obviously changed radically, and with Saudi as a new entrant with a larger market, this is also a good opportunity for UAE-based startups to also scale. So the offering a market that is getting bigger to serve more patients is also a good sign for the ecosystem. And most of the areas of growth are your traditional patient solutions, so patient-centric solutions, medical diagnostics, to a certain extent, to a lesser extent, is remote devices and research solutions, but this is on the rise. And yeah, 2.45 billion was invested in the region from 2019, which is quite significant, and the trend is only on the rise. And a lot of regulatory findings, so I'm sure all the regulators here are busy complaining about the amount coming to them. But let's dive deeper into what drives this growth, particularly in the UAE. One of the most, these are the top trends where you need to incentivize research and support financially the research. So DOH launched, Department of Health of Abu Dhabi, launched the first healthcare research and innovation grant. So not only pure research for the sake of a publication, but also to innovate in the way we deliver care to the patients, in the way we, doctors interact with nurses or with their peers. So that was launched, and it's actually effective this year. A huge milestone is the unification, integration, and streamlining of the EHR systems. So, why this matters is the quality of data you can get, is how structured it can get, how clean. Because you have more mature markets where data is fragmented and unusable. You have a market where you can get for 10 million, a highly diverse population, the wealth of data that is captured that could be used to generate real-world evidence, to really validate technologies by all these startups is unparalleled. Another one is really the knowledge and data accessibility for startups. So that availability of health information made by DHA with their electronic medical library that is launched, and in exchange of a fee, you can access a wealth of information that will help you navigate the market and understand and tweak your solution to fit the market needs. And of course, last but not least, is the growing interest of private MNCs. So you have your AstraZenecas, your Roche, really pushing for real-world evidence to be generated here. Because again, diverse population, we've done a massive clinical trial for COVID vaccine, which proved the capacity to handle a large volume of patients, a highly diverse panel of patients, to really generate insights that are completely unparalleled. And also you have modern infrastructure, you have the talent, so it's really poised to become a growing trend. And even like Philips commissioned, like lately, the first health tech trends research in the UAE. And I think, we talk a lot about that statistic. With the mobile and digital technologies penetration in the UAE and GCC reaching about 98%, the appetite to consume digital solution is the highest. And I can't help but think of an example where I used to be based, China. What made China, really accelerate their digital transformation is the population's demand and excitement about technology. There was no fear in adopting technology. They understood what is the value of technology to make my life easier. So we see this trend of like, yes, I want to digitize the way I interact with my nutritionist or clinician or nurse. I want to get pills delivered to my house. I don't want to go to a pharmacy anymore. So that demand is really likely to fuel the growth of more digital ventures coming out of the region. And let's take a deeper look at the current ecosystem. So I always make the joke about it, but telemedicine, do we need another telemedicine platform? I don't think so, because by now the market is almost saturated in the field. Yet, they're likely, the problem with that is how are we gonna solve the problem of access, affordability, and quality? And how do we monitor that? What makes a good telemedicine platform? How can we ensure a good use? How can we get doctors on board, get patients on board to become a staple in the healthcare system? Clinical decision support as well, remote monitoring, hospital operation. That's an interesting one with how can we optimize processes that are creating waste, causing so much trouble, duplication of records, and so that's what, for example, Claim is trying to do by, easing the bottleneck of cash flow that hospitals may have for the claims and advancing the payment. It's going to be, interesting to see how it's going to be from the patient side, from affordability of care, offering them new solutions to pay and afford medical procedures, especially in an emerging market context. You have your digital health insurance, obviously, because who's going to pay for it? How can we reduce the cost and inefficiencies in health insurance? That's a lot to think. And then new players in mental health. No one wanted to talk about mental health before COVID, but then we acknowledge it's a problem, but then adoption remains low in comparison to other digital health services because there's just simply lack of awareness about such availability. There's still a stigma attached to it, but because of the lack of availability of professionals in the field, we only expect this to rise. Femtech as well. It's half of the population, worldwide population, and many problems are not addressed, from postpartum depression to pregnancy complications. And we need young population because it's aging. So optimizing the chances of healthy babies being born is the top priority for many countries, including in the UAE. And last but not least, I just wanted to give a snapshot of external and international startup foraying into the UAE market. That didn't happen 5 years ago. Why? Because there was difficult access to stakeholders, difficulty to see where the use case, and why should I even scale into a region that is so small? But right now, because of the drivers that I mentioned, from Korea to all the way to New Zealand, all these companies are finding an opportunity to scale into the Middle East, and UAE being a platform for that, because accessibility, quality of life, really the cleanness of data is really pushing these international players to consider UAE as a strong and serious contender. Just wanted to zoom in into when we talk about smart healthcare, so we have a full range of newly created startups to be that we all, by the way, invested in, and that's why we wanted to highlight, just to see the range. From one side, you have a really moonshot digital twin technology about preventative care, making preventative care a reality. So it's going like screening an individual for more than 22,000 diseases. And in a context of an Emirati genome project, you can see how there's a strong fit and a strong demand for, okay, how can we prevent our population from even getting sick in the first place? Using genomics and advising them on lifestyle change, diet change, all of that. Second is tackling the inefficiencies in the operational side of pharmacies, how to procure better, how to use, like, to augment the, optimize the pharmacy solutions and address the bottlenecks. Takallam, which is like the first online counseling platform in Arabic, funny story, they started looking at the Arabic-speaking students abroad that were facing issues of, not finding a counselor that speaks their language. Because for mental health issues, you do know that cultural language matters. And they've been growing quite at a fast pace since then. And WellX is really incentivizing healthy behaviors and really supporting insurance into kind of creating that positive feedback loop so that the population takes their health more seriously and, on the other hand, is also decrease those off-the-chart health insurance costs in the region. And just to finish is like on the theme of going from digital to smart, what are the 3 technologies that are most likely to receive investment in the next few years? And that's pretty simple, AI, everyone is talking about it, ChatGPT, Gen AI, all of this, AI and ML, but the most the most relevant use cases remain in the medical image analysis, so how to aid radiotherapists or doctors to make informed decision based on ingesting a lot of data. Drug discovery as well. I think in silico medicine that is also based here and in China, reduced the drug discovery to 2 years, which is something crazy, because again, it's the amount of data you can ingest and generate new drugs and new targets for the diseases, as well as preventative medicine. Again, it's all about what I can digest from your genetic data, epigenetics, and kind of personalize a treatment plan or a lifestyle plan for you and your family. Then the IOMT and RPM, it's how can we, now that the hospitals are changing in the way they interface with patients, a lot of these happens at home. So how do we connect? How do we access data from the patients to make better informed decisions? Whether it's, and with the rise of chronic disease, this is not less than 158 billion market, and the growth is 12% to reach 215 billion in 2025. So that's a huge kind of growth. Lastly, AR and VR, which is, to your point, Ahmed, is how we're yet to figure out how to use it and how people are using it, whether it's the medical community from a training perspective and reducing human error, but also from a patient perspective for mental health diseases or other use cases. We're yet to see the full potential of AR and VR. And with that, I hope I was on time. Yeah, with that, I would like to call Dr. Han on the stage. Thank you.
Thank you. Thank you very much. I'm the only person standing between you and the break. I'm curious who's in the audience. You're a healthcare provider? Anybody in provider space? Clinic, hospital? Okay. You're representing a startup? Wow. Okay. Any angels in the room? Okay. All the startups are turning around and taking photos of the angels. All right. Any insurance people, regulators? All right. Consultants. Everyone's a consultant at some phase in their life. Actually, I want to get to the break because I want to find out, some of you in the room, we connect on LinkedIn, but you look greater than your LinkedIn profile. So You're taking some 111 drug regimen every day to get to longevity, so I want to know your secret. You know who you are. All right. I thought about how I would frame my talk, and this is what keeps me up at night. And I thought, well, should I use the Amazon example? Maybe Tesla is more appropriate. And actually, I should title this, My Tesla Investing Mistake. All right? This is not a Tesla, but how many people drive a Tesla? Anyone? You've driven a Tesla. Some of you own a Tesla. You're not going to buy a Tesla. I have one kid who says, no Tesla. This is a no Tesla house. And then my son just bought a Tesla because U.S. is incentivizing Teslas. They're incentivizing because they want to go in that direction. Now, healthcare was also reimagined that way in the U.S. because at some point, everybody got one of the companies, right? Can I say their names? Cerner, Epic, Meditech, no longer here. So everyone got it, and they got government incentives. So that's one of the ways healthcare pivots. I probably should have used Amazon. How does Amazon make its money? Do you know? Huh? Yeah, mostly on the cloud. When it started, how was it making money? Do you remember? So I was Googling this because when Amazon started, what kind of company was it? It was selling books. I'm not sure they ever made money on selling books. It's like when you go to your favorite grocery stores in the US, there's some things that are at prices below cost. Okay, and that's what Amazon was doing in order to create the ecosystem. So today when you read books, Amazon doesn't make money on books, but they sell you the reader. So now they've changed the behavior of reading. They changed the behavior of publishing. Anybody publish on Amazon? You can publish, maybe only your family, your mother, your aunt, your grandmother is going to buy your book, but you can have a business model. Amazon can support that because their platform is big. But primarily, they don't make money. I'm not sure they've ever made money. It's a loss leader, but they changed the whole ecosystem. So it is with electric cars. And I heard to drive an electric car, my wife tried out my son's Tesla, and she said, oh, what's the first thing you realize that's different? No noise. With the Toyota hybrids, I experienced that. It's like, turn on the engine again. The engine's on, but the electric car doesn't make that vroom. So if you like your Ferrari, you're probably going to miss that. I'm thinking, they're going to have to put in a recording so it goes vroom when you put it on, but it's not a real sound. It's a fake sound. But it gives you that juice, and to rev your engine, so to speak. But the brakes are different, apparently, in the electric. Why are you laughing? What color is your Ferrari? All right, if you don't know Emily, speak to Emily later. I told her during the break and during the panel, no tough questions from you. Same for Brian. You're in the room. All right, so the braking is different. Now, when I stay up at night and thinking about how are we going to get to health 3.0 or 2.0 or whatever the number is, I think about the electric car. Because today, when you go to healthcare, you may have experienced several transitions. Your experience is different than, well, some of you are so young. I'm old enough to be your parents. I tell my med students that every year. When I retire from med school, it's going to be when that person walks in and I say, I'm old enough to be your grandfather. That's when I retire from teaching medicine. But today, most people have transitioned healthcare. When I started, the doctor often would come to your home. They still do when they visit my mother. Very few people come to your home. If the doctor comes to your home, how is he coming to your home these days? Like during COVID, right? On what platform? Zoom, on your phone. So telehealth is here to stay. There's going to come a time when healthcare experience is going to be transformed, and there's a generation that has never experienced our healthcare 1.0. Just the same way that when my granddaughters start to drive, they will only have driven Teslas. That's where we need to go. All right, so at this point, I actually bought a handful of shares of Tesla. My father-in-law was smarter than I. He held on to his shares. You know how much General Motors is valued at today? On a good day. You know what that number is? It's in the billions. How many people think it's 100 billion? It's about 50 billion. You add up all the three major car companies, maybe 200 billion. All right? So my first mistake was selling Tesla at 50 billion. It's a car company, right? Is it? How much is this company worth? Or ExxonMobil? Anybody own Exxon stock? You know how much Exxon is worth? It had a rough patch. It dipped under, I think, 200 billion. Now it's back, all right? It's $500 billion about, somewhere in that vicinity. So when Tesla zoomed past 250 billion, I thought, oops, it's not a car company. What kind of company is it? Why did he name it Tesla? He's recreating the whole energy grid. I had mispriced, I had misunderstood the whole concept. He's not about cars. The car's just the box. If he wanted to be Apple, or I'm sorry, Apple's the wrong company, but there's some companies that give away their hardware because they're not making money on the hardware. He can give away the cars because that's not the space. And then when it kind of touched on $1 trillion, then I realized, you know what, I missed the boat. Because this industry has started to pivot. Because this is Tesla. And this is where healthcare needs to go. So how do we get there? And I realized, you know what, I'm not going to be able to do it through traditional hospitals, because traditional hospitals, the major spend is not on health. I mean, we say we're in healthcare, but it's really about disease care. And the biggest spend is on people their last 2 years of life. Think about that. So Ahmed touched on some of the drivers, some of the numbers. Big numbers, you need big numbers to do this transformation, or else you have to find the right ecosystem to push it forward. And we don't have time to go through all of that, but imagine this is healthcare. And actually one of my dreams is that health delivery and geolocalization all come together. So that's my patient-centered dream. So hopefully we'll get there. So some of the car companies, they have that opportunity. Now I want to talk about some of the products at Alliance Care Technologies, which I'm the CMO over. The CEO is here. Michelle, talked to her at the break. So we started kind of as a COVID company. Actually, we had kind of an aha moment because we had the right platform for pandemics. But then we realized, you know what, we cannot just live in the pandemic phase, because eventually the pandemic is going to pivot, and we need to decide what are we going to do and leverage our knowledge base from the pandemic side to the next phase of healthcare. And that's kind of where we're at. So during the pandemic, we had a input collection, we had ways to screen patients using AI algorithms, and we could tell you with a pretty high degree of specificity if that patient had one of 20 to 30 different possible infectious agents, because that's one of our history. That's one of our historical products. But that gave us also the infrastructure to build some of the other pieces and to layer on the other pieces that we curate today. So some of the 5 different areas: performance optimization, detection, so precision medicine, which I will spend some time on, R&D, teaching, and infectious disease preparedness. The Catalyst S4 is where we kind of started one of our key products. All right, so to transform healthcare, it has to be focused on the person. And I speak about personalized medicine in many different areas. I usually use the long tail analogy. I didn't put a long tail image on this time, but this is where we are with cancer. And there's several platforms. This is the one that we curate through ACT. And basically, it is, how many people do NGS? You know what NGS stands for? If you don't, you need to know what NGS stands for, because it's the buzzword. It's called Next Generation Sequencing. That's how the genomics projects is going to run. The big companies are typically Illumina or else PacBio. Those are the big companies that run industrial-sized sequencing machines. And if you were to go into some of the big labs that are running country genomics project, they have rooms this size or larger, and they basically line up 20 to 30 of these machines that crunch out genomic data, all right? So in the old days, this took days, and it was very hard to do, but with the chip being much faster, smarter, we can get this information. So every person has a unique cancer, okay? And I'm going to get to this hopefully at the end because the question always comes up, well, with AI, what are the doctors going to do? You're going to retire because there's no jobs. All the machines are going to do the work. Well, actually, it does get rid of certain jobs. So for example, today there's so much information, I can only know one organ system in the body real well. So when I was starting my practice, I could understand most of disease states. Kidney disease, oh, I'm an expert on kidney disease. Heart disease, yeah, I know a lot about heart disease. Skin disease, a little bit, the dermatologist is very good. But today, with so much genetic information, I'm an expert only on the right kidney. If I'm a kidney expert, that's a joke, okay? Because the right kidney, there are some differences, right brain, left brain, men and women, right kidney, left kidney, but by and large, you can only understand one organ disease. Most of us who practice in medicine, we're specialized, so we only understand our organ very well, because every patient is different. Not only is every disease different, every patient is different. So the genetic data on a tumor is different from every individual patient, even if you're related. Possibly in a twin, there's a lot of genetic similarities. But the way this works is that there are many medicines, and there was a slide alluding to this, certain medicines will only work with certain genetic profiles of the tumor and also the host, okay? So you put it into an AI algorithm that optimizes it for chemotherapy, and this is what it's trying to tell you, that CureMatch is one of the platforms. If you have a cancer, it matches to the right protocol with optimized treatment strategies. 1 drug, 2 drug, 3 drug strategies. Ophthalmology is one of the fields where AI is making a big impact. So we have a couple products that focus on retinal scans, as well as eye intelligence, as well as training patients. So I actually tested this out at Arab Health. It takes only 5 minutes. And this is an incredible platform. It's been a partnership in Australia as well as parts of Southeast Asia. So it's been tested, has large numbers. And one of the things I'm really excited about is AI extends the ability of a typical practitioner so we can scale and we can acquire increased expertise without the typical training that's required. Think about that. The closest analogy I can think of is when a surgeon uses a robot. You know about the robots, right? So for a while we thought, oh, robots is going to take away the surgeon's job. But nowadays, you hardly can do any procedure without a robot. And the robot has basically increased the ability of surgeons to perform at a high level. So will AI transform medicine. It will take away jobs, but the jobs that will be lost are doctors that refuse to use AI. So I will keep on working as long as I'm willing to learn my new work processes. That's the reality. Okay, so AI will help us. So retinal screening, detection, and there's also certain modules in which we can train the eye, and we have other modules in terms of physical therapy that gives patient feedback. So individualized, personalized, patient-focused, and focused on outcomes. So one of our key products is called Catalyst Value, and this was piloted in the USA, and what we discovered was that we can take physician metrics, specifically orthopedic surgeons, and then we can compare across a group, we can compare across different locations, and then we can show on the value curve who's the best performer in terms of cost for outcome. This is scary, because some of your companies have products that produces benchmark. Doctors don't like to be benchmarked, but you know, this is the administrator's dream. You can anonymize the data, but if the physician sees data, he can no longer say, oh, I'm the best blah, blah, blah in this specialty because of my reputation, because my patients write these wonderful reviews. Well, this tells you at the administrative level, the chair level, and the individual physician level, what's the cost of you doing a procedure and how are your peers performing? We're talking not about charges. Everyone knows the difference between charge and cost, right? So that's actually one of the courses I'm teaching at the med school, about the total cost of the procedure. So how much OR time are you using? What antibiotics are you using? How much nursing time? And then what are we using in terms of resources? And how often do the patients come back and have to be given Uncompensated care, that's an administrator's nightmare. Uncompensated care means the risk is to the administration. That means the patient gets infected or they have to reoperate or something goes wrong. All right? This is the whole equation. This is one of the value products that we offer. And the regulators love this. The hospitals hate this. Most of the places now, you can get paid, but the regulators can look at your charges. They can look at your records. And I think in some countries, I think UAE is like that, they have 2 years to recollect if they find an anomaly. Okay, think about it. You don't want to be caught in that position. So this is where value-based type of process works. So this summer I actually spent some time, this slide was taken from my practice in Kentucky because this is where imaging, pathology, radiology is going. This is AI in live practice. So in my actual practice in the university, I have a resident. So the trainee, he actually pre-screens the slide. So I have 2 eyes looking at it, the machine and another human before I look at it. So I can almost sleep through this process because 90% of the time, the resident writes the right thing on the note. I just fix my name, press the button, report is out. This is even better. You know that black dot? I could train every one of you in this room. You know what that black dot is? This is a prostate needle biopsy. Breast biopsy is the same thing. The black dot is where the cancer is. That's how good AI is today. All right, so we have algorithms, breast cancer, prostate cancer for guys. They can put the dot right on the place you need to focus on. I could do this from a car. I could sign this out from anywhere in the world. And that's what AI allows us. It distributes the work. It can optimize the work process. We're in conversations with different groups to look at how AI can transform imaging, pathology, and some of the ways we practice. So AI is here. It can predict genetic data. So there's a lot of AI algorithms. It can also improve work processes. I think I'm getting close to where I need to stop, and so we can go to the break. Huh? That's a real live prostate biopsy. I removed the name, so you can't tell unless you're really, really good the name of the patient. It's not there. But it is a man. That's a prostate. Okay. All right. So this is one of the exciting platforms we're looking at, which looks at multiple different platforms, and basically through AI and network analysis, we're in early discussions to see how we can leverage SonRight. So AI is here to stay. We either work with it or we become obsolete. And I think that's the last of my slides. Thank you for your attention.
Excellent. Thank you very much. I know there are so many questions, but we are running out of time, and you can interact with the panelists during the break. With that, please join me. Thank all the panelists. Thank you very much for today. A great session, and I look forward to seeing all of you in October. Thank you.